Hi, I'm State Representative Bruce Ayers, and I want to thank you for tuning in to my legislative update. As a state representative, I realize how important it is to be accessible and to keep my residents informed on issues we're working on at the State House. In an effort to do this, I want to thank Quincy Access Television for helping me produce this show. My guest on today's show serves as the House Chairman on the Joint Committee on Aging and Independence, working on many senior-related issues throughout the Commonwealth. He's a friend and a colleague, Representative Tom Stanley. Tom, thank you for being on the show.
Thank you for inviting me.
It's nice to have you here. I know it's a great chance to talk about a lot of issues dealing to our senior citizens. You and I get an awful lot of calls from our seniors, particularly, feeling the financial strain, living on a fixed income, while costs continue to rise on utilities, housing, prescription drugs, and beyond those financial challenges, they're also concerned about quality access to health care, long-term care, and home care services. Why don't we start by talking a little bit about the new home care revised law. I know it was signed into law back in 2024 by Governor Healey, but it's the first time, I think, in 25 years that they set regulations to improve on nursing home facilities and assisted living facilities. Can you talk a little bit more about that as chair?
Sure. So it was the long-term care bill, and it was the first update in over a quarter of a century. So it was very significant. And, all the problems with nursing homes are well documented, whether it's untrained personnel or, abuse, physical, sexual, verbal, on patients or on employees, companies that buy nursing homes that, put the dollar first and not the care for the individual. So we put in a lot of reforms, and for the first time ever, companies in their management companies, there's a lot of them will hire management companies to manage the facility. So if anyone has a financial interest of 5% or more, they need to disclose their finances to the state. That's important because we want to know who owns and operates these facilities. Because, for a long time we didn't know. We want to know what their motives are, what their history. So another provision is the state will be allowed to look at their criminal history, the owners and managers, both in Massachusetts and around the country, as well as civil court history, as best as can be discovered. And again, that drives us towards the character of the individuals that are running these facilities, and we want to make sure that they're good people and in the business for the right reasons. There's a lot of updated fines for the Attorney General to be able to initiate in terms of if the facility is not performing up to the standards that the state wants it to. And also in the individual abuse things that we just talked about, but also DPH, Department of Public Health, in the past was always like it was a punitive relationship between DPH and the nursing home facilities, operators and owners. So now we're giving the authority, or DPH, to get involved earlier in the process and work together with facilities to explain to them what they're not doing right and what they need to do better. And for the first time, the state will be able to appoint temporary managers. So these are all very important, because in the past too, if there was a well-meaning nursing home facility, they were hesitant to contact the state because they want to get fines and just written up and bad press and so forth. But now they're going to be working together to make sure the facilities are safe for everyone.
They really raised the bar, and along with that, set up some consequences for those who don't comply.
Exactly.
Yeah, it's a great initiative. Let's talk about the fiscal 2027 budget. I know that the governor supported a lot of the initiatives that were put into that bill by the legislature, funding for numerous programs for our seniors, residents, so they age in dignity. Can you talk about a few of the provisions of that bill?
Sure, and for the first time, the budget for age-related programs is over $1 billion, so it shows the strong commitment of the state. The state has for people that are aging, and that population is growing, as we know. So one of the important parts of it, it's about over $300 million for the home care program, which, if anyone's familiar with ASAPs, it's Aging Services Access Points, and there's about roughly 25 in the state, the regions, and they're run by different nonprofit organizations like, say, Mystic Valley Aging Services or Minuteman, and so they contract with the state in order to provide various services that the state wants to be provided without hiring all the employees and so forth. So then these ASAPs will go out and make other contracts with home care providers, people that will go to folks' home to assist with everyday living, and there's all sorts of programs in order. So the longer we keep people in their home, they like it. They're around their doctors, their friends, their family, the community they're familiar with, and the longer we do that, you prevent or delay their needing more acute services in assisted living or nursing homes, rest homes.
Sure. That's it. Yeah, I mean, the goal, you just hit the nail on the head. Seniors want to stay at home, living in an independent lifestyle, and with some other services that maybe can help them out get through that.
And so I'm going to point out the SHINE program, and I'll give my own experience. Before I was chair of the committee, but I was a representative, and I'm pretty, we're all pretty familiar with these programs because we get calls about them all the time, and we fight for funding and so forth. But when my father needed services, I started to panic, like, oh my God, what do I do? And I remember thinking, like, I'm a state representative, I should know this right away. But you start to wonder and panic, and you want to do the right thing. And up until now, it's been pretty hard to figure out, the right services. Unfortunately, we fund about $1 million every budget for the SHINE program, which I can't remember the acronym, what it stands for, but it's basically the state hires people to be experts in determining the needs of individuals and then the programs that would fit their needs and connecting them. So you don't have to worry. You just go down to your senior center or just make an appointment with the SHINE services. Council on Aging can help, or your office, my office, wherever people live, and can connect with the right people that can, get the right services for the people, as they need them.
That's a great point. There's so many resources out there. I think when people are faced with some of the choices they have to make as they age in place, we certainly want to encourage them to contact their local council on aging, contact our offices. We can be a conduit to the proper resource and help them get any information to help them make a decision that they may be coming to.
Right.
Let's talk a little bit about Alzheimer's. I know you and I, over the years, have worked on a lot of bills together. And back in 2018, there was the Mass landmark Alzheimer's legislation that provided new responsibilities for physicians for highest quality in training and education. And then again, this year, our colleague, Representative Danielle Gregoire, improved on that law. Can you talk about some of the improvements and how they work out?
Sure. Just in general, Representative Gregoire has done a phenomenal job in this area. And, you've taught me more about Alzheimer's than anywhere else that I've learned it really, especially before becoming chair of the committee, in your work regarding this disease and early onset Alzheimer's and so forth. So it's just really, it reemphasizes a lot more, the training and properly training other people that are providers in one way or another, so that they know how to deal with someone with Alzheimer's. They know what to pick up on, what not to pick up on. As chair of the committee, I can tell you, we had one gentleman that came in and testified, and he, had a professional job. I don't recall what it was, but he was able to work from home, and he was doing that to take care of his wife, who developed dementia, and it was, slowly getting worse. And so he started looking out for, home care help, and he went through 7 agencies before he found an agency that knew what they were doing in dealing with a patient with Alzheimer's. Because prior to that, they might have had someone that was just sitting there, babysitting and not helping, not engaging, with the individual. So Alzheimer's 2.0 is really implementing a lot of new training for people at every level, to ensure that they're able to help, because it's a growing issue, and the aging population is growing, people are living longer, and therefore Alzheimer's is growing, even though there's been great strides and innovations with medicine and just care for those with Alzheimer's.
Sure, and I know you and I worked an awful lot too with the Alzheimer's Association on removing the age restriction so people could get services for early onset Alzheimer's too. That was always a tough law that was in place. If someone had suffered or been diagnosed with early onset Alzheimer's, maybe in their 50s, that they wouldn't qualify for state services. But now that has since changed, and there is help out there for people who have early onset Alzheimer's. So
that's really doing really seriously in large part due to your efforts. I know you have a friend whose spouse had early onset, and you talked to me about how difficult it was for him, and I forget the details about it, serious strain on their financial situation, and I don't recall if he had to give up working altogether, but it was a big strain financially, and that's why it was so important to get folks that are earlier in age, these resources.
Absolutely. Let's talk a little bit about home care services. I know Massachusetts, I think, is only one of a few states in the country that does not require home care agencies to be licensed.
Right.
Last November, I know our colleagues joined together to establish a licensure procedure for these home care agencies. Can you talk a little bit about what this means and how it'll help?
Sure. This was, another bill that I filed with, the same as the long-term care bill. And just to take a step back first, there's a continuum of care for aging. There's home care, assisted living, and long-term care. And when Speaker Mariano gave me this position, he really emphasized that he thought that we needed to make some significant improvements in the services and update our laws. So we were able to do that with the long-term care bill, and the long-term care bill, probably talk more about this maybe later, but included upgrading assisted living laws for the first time in 25 years. During the pandemic, we found out that most people were dying in the nursing homes. So we were trying to keep them in the assisted living facilities. They were more equipped with separating individuals. So we allowed them temporary approval to do that because they weren't that industry wasn't set up in the beginning to provide any kind of healthcare services. But we allowed them to do like 5, important things that are not, don't require a nurse to do it. But by state law, you either, needed to hire your own nurse. You could do it yourself, but a lot of people live far away from the assisted living where their loved one ends up. And so anyway, long story short, we were able to change that. It was a big battle, but we're able to allow assisted living residences to now provide these services like anointments, help with some wounding bandage, eye drops, the diabetes injections, things like that. Getting back to the first part of the continuum home care, we passed in the House the home care licensure bill, and early in the session. And I think if I remember right, the Senate just passed it as well in the Senate. If not the end of last week, this week. And half the agents, getting back to your point, half the agencies are licensed essentially, and those are the ones we know because they're licensed through contracts, through the state's contract with the ASAPs and then their contracts with the home care providers and their employees, the people that go into people's home to provide services. So they have to be held at a high level of accountability and standard.
Sure.
And really know what they're doing. But the private agencies, which could be just one person, or it could be, 5, an agency of 5 or 10, or much larger ones as well. And some of them are very good, but we don't know who all of them are. It gets back to my point about, when it happens to your loved one, it's like, it's coming, but you don't know exactly what you're going to need to do. And then it happens, you're like, okay, we have to get services right away. So this new legislation will ensure that all these people are licensed so that everyone knows that what they're getting as a consumer, and that our loved ones are getting, services from people that are trained properly to provide them. And so it's real important. The industry's been calling for it, ironically. It is provided in well over 30 states around the country, and I'm very confident that we're going to get it done this session. Whether we get it done before the end of July or not, I think there'll be a conference committee, and we'll get it done before the end of the year. And that would be 3 big major pieces of legislation on the continuum of care: home care, assisted living, and long-term care, which is nursing homes and rest homes.
Yeah, and to your point, a lot of times these decisions have to be made quickly, and you want to have the assurances that your loved one is going to be in good hands, right. And this will provide a safety net that these people are well trained and have the responsibility and empathy that you want to have in that type of position.
Right.
Why don't we segue into family caregivers? Caregivers, I know in Massachusetts, I think there are over 1 million people that find themselves as becoming caregivers, the latest statistics have. I hear from residents, I know you do too, how hard it can be, for someone who has a job, raising kids, taking care of a loved one at the same time. Financially, they're trying to do everything they can to help their loved ones stay at home, live in dignity and independence.
Right.
Can you talk a little bit about what the state is doing to help out with some of those resources to make it easier for families?
Sure. Well, I think the most important thing right now is a commission, a proposed commission that Representative Mike Kuchmarek from Fitchburg brought forward and was included as an amendment onto our home care licensure bill. And that would have a special commission to look into, what we can do for family home givers in terms of, paying them, and we'll look at all the difficulties that they have, the financial difficulties, which, getting back to your friend whose wife had early onset Alzheimer's. So I mentioned how the aging population is growing very, very quickly. We're the last of the baby boomers, and there's a lot of us, and it's just, people over 60, 65 are it's just growing and growing and growing. At the same time, the number of caregivers are decreasing, and that's for a lot of reasons. The work is hard. The work doesn't pay extremely well. Oftentimes we're fortunate to have immigrants do this work. Now, with the federal government's crackdown on immigration, we're finding it very difficult to keep home care, home givers, and plus they can get paid just as much or more at Home Depot or McDonald's or something. So we put in to our legislation a lot of incentives for people, career ladder incentives. So we would provide training for CNAs to move up the ladder to be assisted nurse practitioners, or ultimately, become nurses. And we do things like, okay, look at the obstacles. Some of them need someone to watch their kids. So we provide some childcare so that they can take the training courses and the exams. Others just don't have the transportation to go to do these things. So a lot of provisions like that, we're looking at, the obstacles and trying to eradicate those. And another cost in all of this is the state takes at least 2 years during COVID. It went up to like 4 years in review to update the cost of inflation, and including, for all the services, including employees' pay. So that makes it more and more difficult for the industry to pay employees and a fair wage and to keep them. So there's been a number of very, very successful commissions. One of them is the Assisted Living Residence Commission that I was on. So this one being proposed, I'm very confident that we'll be able to get it in the final home care licensure bill. And so before, everyone had 5 or 6 kids at least, right? So you had a pretty good chance of family members being able to take care of you, and people were, living together and so forth. And so nowadays, people are having 1 or 2 kids, and if you don't have girls, you're at more of a disadvantage to think that someone's gonna, your kids are gonna take care of you.
Yeah.
Not, unlike in your family, where you and your brother did great service in taking care of your parents. So we need more caregivers, and we need to look at ways to help recruit, retain, and also assist family caregivers so that they can not be in as much financial strain going through the process as well. So that, some people, they're like, I don't know how I'm going to be able to pay for retirement because all the money's going towards the care.
Tom, can we talk a little bit about the MassHealth funding outlook? Action taken by the federal government down in Washington by the passing of the One Big Beautiful Bill, could result up until $3.5 billion in a loss of funds towards the Medicaid funding. According to our partners at MassHealth, can you explain how this federal policy could affect the Massachusetts consumers?
Sure. Well, elections have consequences, and the results of the last presidential election has consequences. They're cutting federal funding for health care, mostly Medicare, for Massachusetts up to $3.5 billion going forward. So if it's fully implemented, which they delayed fully implementing it to get past these elections, the midterm elections at the federal level, there's going to be some real pain for people just not being able to afford any healthcare services, and or not being able to get any insurance whatsoever. So Medicaid, we call it MassHealth in Massachusetts, is the federal government's funding formula for helping people that are really just, unfortunate in their financial situation and can't pay for anything.
Mm-hmm.
This is where it's going to really hit hard, and that's where a lot of people would get help, because Medicare doesn't pay for these things either. It pays for other healthcare things which are going to be cut. So more and more competition for the healthcare dollars. So it really is going to be devastating, and that's an election consequence, as well as what's happening with the immigrants, the people that do the work in these long-term care and home care positions. So another bill, if we have enough time for it, that I've proposed, it's another commission, which there's an editorial in the paper today, which is July 15th,
Mm-hmm.
in the Globe. Big, long, I'm grateful that they did this, regarding long-term services and supports. It's a catchphrase basically for all the services that people need on the continuum of care, from home care, assisted living to long-term care, and how people can't afford it. And those that have to rely on MassHealth, they have to use up their life savings in order to have better access to all those fundings. And that leaves little money for them to leave to their families and so forth. So anyway, long-term services and support. Do we have enough time?
We're just about wrapping it up.
All right. So it would be a new program to make sure that everyone is more prepared to pay for their own financial needs as we get older. We could talk about that another time.
I'd like to. They're telling us our time is just about wrapping it up, but thank you for agreeing to be on the show. I know how busy you are crisscrossing the state, talking about senior issues and how they impact the residents of the area, but we'd love to have you come back on the show because, to your point, there's a lot going on, both at the national level and the local level, that we need to keep an eye on to make sure at the end of the day, our constituents are getting the quality of care they deserve, So thank you very much for being on the show. I want to thank the residents for tuning in to the legislative update. If you have any questions on any of the issues we talked about today, I certainly encourage you to contact my office. I can be reached at 617-722-2070. And I want to thank again, Quincy Access Television for allowing me to produce this show. And thank you for tuning in.